Leading off our discussion tonight, Dr. Ashish Jha, the director of the Harvard Global Health Institute, and John Hyland, national affairs analyst for NBC News and MSNBC. He is the co-host of Showtime's The Circus and the editor-in-chief of The Recount. And Dr. Jha, I want to get your sense of where we are tonight. It seems like New York is on a downslope, but is it in fact the case that the rest of the country, when you look at the country as a whole, we're at a plateau? We are not actually moving downward.
Yeah, so thanks for having me on, Lawrence. What we have is a tale of two countries. We have New York, New Jersey, Connecticut, parts of other places where the cases are declining. Ohio, California, where if you put them in aggregate, the number of cases is declining. And then you have the rest of the country, the second half of this story, where it's not just flat, it's actually rising. Now, not everywhere. Some places it is flat, some places it's low, but aggregate, the rest of the country is increasing. And so this whole idea that, and that's why on average it comes out flat, but this whole idea that the country is ready to open up really does not comply with the facts and data on the ground.
But doctor, what about regions of the country? Governor Cuomo is talking about possible upstate regions of New York State being allowed more kinds of public activities than the downstate region and New York City.
Yeah, so look, I think we can have very localized policies. I don't think that's unreasonable. If some parts of upstate New York really have few or no cases or substantially declining cases, but I think they're going to have to worry about things like, so what happens when part of the state opens up and people from New York City get in the car and drive up there? Because people move, and people move within states, they move across states. So I'm not opposed at all to kind of regional focused policies that are driven by data and science. I just think we have to be careful about how far we push that.
John Heilman, the White House coronavirus task force seems to be disbanded. We will not be subject to those end of day 2-hour performances anymore until, I guess, Donald Trump gets too bored and decides to go out there and try something else on television.
Yeah, Lawrence, and I think I appreciated your opening to the show tonight. It was grim, and I think appropriately grim, given where we are and given the kind of extraordinary back-to-back nature of the last 2 days, where we learn about, on one side, projections and models and forecasts within the administration that suggest that May and June could be extraordinarily ugly in the United States when it comes to coronavirus. And the very next day, the White House announces that it's shutting down the coronavirus task force. I agree with you. I think the task force and its public relations orientation has been close to useless in terms of actually getting anything done. And yet on the political side, to see Donald Trump at this moment having what can only be described as a mission accomplished moment, if that is in fact where we're going, shutting down this coronavirus task force and basically saying what he's now saying, which is, a lot of people are going to get hurt. Some of them are going to get hurt really badly going forward, but we must reopen this economy. The economy is key to him politically. And at this point, he seems to be essentially saying, I don't really care about public health to the extent I ever cared about it. We're moving on from that. We're into a new phase. And I think it's extraordinarily dangerous, obviously, for the country, but also I think extraordinarily reckless politically for the president if his hope is to get reelected.
John, I think one of the last numbers that Donald Trump himself, in his own imaginary projections, offered in the White House briefing room was 50,000. He was saying that he thought they might actually hold total American deaths to 50,000. Is it just that Donald Trump doesn't want to go into that room anymore when the numbers are going up and up, and his administration has some projections that indicate that the death rate could be doubling in the month of June, and they could be announcing 3,000 per day?
Yes, I think Lawrence, we've talked about various strategies or tactics that President Trump has tried in the course of 2020 with respect to COVID-19. The first was downplaying. Then we had blame shifting. And now, more recently, we've been in the moment of goalpost shifting, where that 50,000 projection that he gave that one day in the White House we actually got to 50,000 that week there was like a Monday that he said that he thought it might only be 50,000 deaths, and we actually crossed over the 50,000 threshold within 4 days of when he said that. And I think we've now seen him ratchet that goalpost, push that goalpost further and further down the field. It's now apparently he's setting 100,000 as the marker. But I think even Donald Trump, who never tires of mendacity, never tires of lying, never tires of innumerateness. I think even Donald Trump, that never tires of goalpost shifting, I think his arms are getting a little tired, and he's starting to realize that it's getting to the point where even by his standards, it's too ludicrous to continue with this effort, and it's not only ludicrous but politically counterproductive.
Dr. Jarr, let me get your reaction to the apparent closing down of the White House task force. They will continue to do their work behind closed doors. Is it going to matter that they don't have that public display every day?
So, Lawrence, I agree with you that a lot of what was shared in those 2-hour-long events was not very useful. But some of it was, and especially when Dr. Fauci spoke and Dr. Birx spoke. That was useful information. And the signal to the country of, we're not doing that anymore, I think is really harmful. And the way I've described this is, we are, to use a baseball analogy, we are, kind of in the second or third inning of a baseball game. And what it feels like is the manager has decided just to leave. And that's a problem. We need our manager to get us through the game.
Dr. Ashish Jarr, John Heilman, thank you both for starting us off tonight. We really appreciate it. Thank you. And when we come back, global pandemic expert and journalist Laurie Garrett has been one of the indispensable voices in our coronavirus coverage. She will join us next on what she says is the most important question that is not being asked, and it affects everything: testing, tracing, reopening. Laurie Garrett will give us